to actually know what is happening in the field in real time. So now the methodology used here, we looked at collecting data. So for the case study, we used the Osun State governor election results. So we got that from the INEC portal to actually help us to create a web map of the results of the election. We also got the administrative boundaries of different local governments, and we also got some polling unit data also. And for the primary data sets, we actually used a dummy data to see how this solution will look like and how it can also help in decision making. So we looked at collecting incident reports from different stakeholders, from the NGO, from the INEC officers, and also from the citizens themselves. So here we can see the workflow. Here's the next. All right. So for the incident report, this actually shows this schema of the incident report. So here we have different observers. We have the INEC officers. We have the NGO observers. We also have the citizens, right? So all these are coming into a central database, which is gotten from the application, which is a report incident application. And most importantly, we capture the location of where these reports are coming from. Because you can just capture, incidents and have them spread on a database. But if you don't have them on, if you don't have the location attached to it, it will not make, meaning, and for you to also help you visualize where these results are coming from. So yeah, after getting the data, we actually customize a visualization dashboard to know different events happening at a particular time. So the stakeholders, which can also these stakeholders can consist of the INEC directors, different security agencies for operational awareness, and also now we also looked at what are the incidents to be reported, right? We want to look at vote buying, we want to look at illegal voting, where INEC observers can report this thing in real time, what is happening in the field in real time, and INEC can help to enrich their investigative analysis and see how voter sentiment is influenced by some of these incidents. And we also want to look at why vote, for example, we want to look at why some local government areas have low turnout and some other local governments have high turnout. So you want to look at what really influenced that. So this report can give you an holistic, investigative report to make some decisions. Sorry, the next slide. So here we can see a dashboard created. We look at the total report. So this is actually dummy data. So we look at total reports coming in. We look at vote buying, the violence. We want to look at also the incident category based on the responsible group, right? So we have different responsible group in election, misconduct and violence. We want to look at some are influenced by political parties, some are influenced by thugs, and also we want to look at the different incidents. We want to look at illegal voting. We want to look at ballot box snatching and other violence. And the INEC observers or the citizens, who can be anonymous too, can also upload, a picture or upload a link to a video where they have reported such kind of incidents. So, next slide, please. So I'll just rush through this solution content. So the solution content consists of also an election results dashboard. So what we did, we customized, after the incident report, we also customized a real-time data collection of election results based on the local governments, the candidates who is actually vying for these positions, to upload it in real time. So after collation of results, it can be uploaded to the database, and it can be visualized on the map and based on the party who wins the election. So you can go to the next one. So for the results of this paper, we looked at some of the low turnouts in Osun State. We looked at a low turnout of about 29% in Orulu and Ila local government, and in Ila local government we saw a high voters turnout too. Now, and also according to Statista, we know that 50% of the voters, which is about 44 million Nigerians, have access to smartphones, which is actually half of the registered voters. And this can also be used to help them report incidents by educating them on how to report incidents, which normally they can't talk about, because we see different sources of information from Twitter, from Facebook. But if the INEC just have an holistic incident report, which they can validate by themselves, which they will have some coming from the NGOs, which is verified, coming from the field officers, which is verified, coupled with the citizens, which they can also verify too, then they can actually make informed decisions.
Bamidele, can you try and round up? You have exceeded your time.
Okay, sorry. So in conclusion, this solution was actually demonstrated that utilizing the spatial technology in elections are scalable. So now this solution is actually scalable to either local government, states, and also the federal government. So it was also found out that engaging the public and also different stakeholders from NGO and also the ad hoc officers, which are the INEC officers, can promote confidence in election results. So one of the things that the solution also captured was, after a citizen reports an accident, he automatically gets a mail which is integrated with the Microsoft Power Automate, which brings them closer to the INEC body to see that they're actually responding to this, and they will take and investigate this report as it's being submitted. So thank you very much. So lastly, we also know that our vote is our choice. So this year we should vote wisely. Thank you very much.
Thank you, Bamidele, for your presentation. Please, ladies and gentlemen, if you have a question or a comment, we will request that you put it down and write it first. So don't forget, we want to take about 2-3 presentations before we begin to ask questions and comments. Okay, can we take on the second presenter? Mr. Laka Shola, are you here now? Okay. Huh? Yeah, it's there.
Good morning, all. The chairman of GEOSON and the ESCO, the board chairman, and our fellows and members of this society. My name is Edward Lahore. I'm standing in for Mr. Shola Laka. And the paper is unavoidably absent. He's a lecturer with the University of Jos, Department of Geography and Planning. The title of the paper presentation is a GIS-based multi-criteria analysis, and AHP, that's analytical hierarchical process modeling for flood risk mapping in the Dilimi catchment area of Jos Plateau State, Nigeria. Can we go? Next slide. I'm sure we are all aware that of the recent happening about flood and the importance of studies like this in our communities. Basically, the Dilimi flood are disaster recorded globally and are as a result of either natural and occurrence or man activities. Man activities within urban catchment affects urban flows in streams and makes them more hydrologically active, leading to floods. The need for flood risk and assessment is so important, as I have just said, with the recent happening that we have heard and seen. Go to the next slide. The GIS in flood mapping has come to stay, especially in our community because of the lack of data on rainfall data and other river flow data. And because of lack of such data, GIS has offered a tool for us that we can be able to analyze flood and then predict. And the study area, can we go? Okay. The study area, that's the Dilimi River, is the headwater of the Dilimi Bunga River system, a subsystem of the Church drainage. That is from Jos, that catchment ends up at that Lake Church. And there are frequent incidents of flood in Jos. I think it occurred, was it in 2003 or 5, that it caused a lot of havoc along the Dilimi River. The spatial coverage of the basin on the study is about 163 kilometers, located within Jos urban area, that's capital of Plateau State. The river network, go back. The river network presents a dendritic pattern and takes its course some 10 kilometers southeast of Jos town, flows through Jos city, then northward to the Bauchi Plains. You can see the location. This is the map showing the catchment area to Lake Chad Basin, and this is the catchment area within the study area. This one is the total flow of the Dilimi and its tributaries. Next. The need for multi-criteria analysis. For this work, two broad groups of data was used, vis-a-vis the Alos Plaza Dam and the Food and Agricultural Organization Digital Soil Map, that's FAO, of the world. This involved the generation of thematic map layers based on 4 causative drivers. These drivers are the corridor, the soil, the elevation, and the sloped. Soil, elevation, slope, and corridor. The corridor, slope, and elevation were generated from the dam data, while the soil layer was generated from the FAO's digital soil map of the world for the study. The corridor, slope, and elevation were data were classified after SATIS 9 scaled. Based on that SATIS classification of events, he has used that to classify these 4 drivers that has been selected for these studies. So the criterion weights using the analytical hierarchical process, the interrelationship between these drivers were derived using the SATIS 1980 AHP, as we saw in the previous table. And a relative important matrix was derived. You can go to the next slide. Let's see the relative important. No, up. Go back. Okay, there's this relative important matrix. Okay, down. Okay, go back. I don't know. It's not here. Go back. Okay. Integration of flood driver map and hazard map production. Weighted data sets were integrated into ArcGIS 10.3 to produce the flood hazard map. The map produced from the weighted overlay operation was then reclassified into 4 hazard classes. That is the very high hazard, the high hazard, the low hazard, and then the no hazard zone. So from the 9 classification, it was further reclassified to these 4 classes of hazard so that we can be able to see which area is more affected. Let's go on. This classified spatial extent map generated from the flood hazard map was overlaid on the 2017 Landsat dataset, which had on a priority been subjected to a supervised classification to extract all LULC that are within each risk zone. The 2016 high-resolution quick-bite image and the catchment extent was employed to update their earlier acquired building forms, shapes, files for the catchment area. That was used to determine the number of buildings that were affected within each of the zones. Selection by location was employed to isolate all buildings forms within the catchment and in the flood zones. So the result of the analysis, thematic map for each driver in the catchment area is presented in our map. The criterion weights for flood drivers in the Dilimi catchment area, and these are the pairwise comparison of 4 flood drivers using the AHP is presented. Let's go. So from this table, this is the first, the one that used the SATIS classification, which has about nine classes. Then a further, okay, these were the one that was done, for the corridor, the slope, the elevation, and for the soil. These are the soil type in the area. This is the multi-criteria elevation for the criteria analysis for the slope, while this is for the elevation and this is for the elevation. So let's go. Okay, this was the table I was trying to refer to at the initial stage, based on the drivers of the importance of the drivers. You can see from the drivers, the corridor has more important and the slope, while the soil is less, because we know that soil is usually more or less constant without any indonation. Okay, the output map was reclassified into high hazard. Okay, let's go to the next slide. Okay, that's the final output map for the analysis. You can see this is the first one based on the SATIS classification, and based on that we use the AHP to now reclassify them into the very high risks, very low risks, and no risks. So at the end of the day, these are the areas that have been analyzed to fall within those zones. So within here, you can see the building that falls within the catchment area of the zones. And here, from that analysis, you can see that there are about 5,306 total buildings at risk within the building, within the zones, the flood area. That's the total building within the structure of the catchment area is 95,999, out of which 5,306 building structures were found to fall within the high risk and very high risk flood inundation areas, representing about 5.5%. So out of the building within the area, about 5.5%, that's 5,306, are at high risk of flood. Multi-criteria analysis and AHP approach employed for this analysis show that 5.7, okay, which is between, that's within 9.3 kilometers of the study area is within a very high risk and high flood risk zone. These areas accommodate a total of about 5,306 buildings. The flood risk map reveals areas where planning, developmental control, and possible mitigation are to be implemented. It also will assist decision makers and watershed managers in effectively developing strategies for the control and mitigation of future flood occurrence in the area of the catchment area. Thank you.
Thank you very much. We didn't get your name, please. I know you are standing in for Laka, you said.
My name is Edward Lahore.
Okay, thanks. We appeal for you to put down your comments. We shall come back to you very soon. Thank you, Edward. Okay, the third presentation we want to take now is on the online man. Is he around? The online. We wanted to have a lecture. One of the guys online. Is he available now? He's not the one. Okay, can we have Edet E. Otu and Chinasa Utai? Is he available now? Okay, step there. Your paper is titled Geospatial Analysis of Antimicrobial Resistance in Nigeria. You have our ears for 10 minutes.
Good morning. Standing on existing protocol, I would like to present a paper that we've been working on. My name is Dr. Edet Otu, and I want to present something that is dear to my heart. So it's about the healthcare services. I did my PhD in health geomatics, if you call it that way. And my interest is in study of health, and we did this work together, Dr. Chinaza Uta being the lead author there, and we have Awan there as well. We are all of the University of Calabar, Faculty of Environmental Sciences. Can we have the slide, please? So what came to your mind the last time you or a loved one was ill and you weren't getting well soon, and after all much medication, what was the fear that came to your mind? What were the possible explanations that came to your mind? Did you think about witchcraft? Maybe some powers in the air were affecting your health, making you not to feel well? Did you think about the enemies from the office, from the school, or from somewhere? Or did you think about juju or village people who don't want your progress? So these are possible explanations that we give to our inability to get well soon. But I have a fourth answer that you would like to see. I'm talking about antimicrobial resistance. Antimicrobial resistance is a war that the microorganisms over the years have been fighting to come back after 1929 penicillin invention, which many microorganisms were put to a hole and they were unable to act, and diseases were cured. And by this time, after about 100 years, they are coming back with new technology, new fighting skills to make drugs ineffective. So such as bacteria, we have bacteria, the virus, the fungi, and other parasites change over time such that the medication we take no longer have effect on them. And so the MR mechanism has different ways it happens. It limits uptake of drugs. It modifies the target. So when you take the drug does not work. It changes the way the organism behaves in the body so that it does not work. And it also does the active drug efflux, in which it automatically transports the medication you take out of your cells. So they don't have to work even when you are taking many medications, so they don't work. And then we have the resistant core in different way. They change the way they operate, the dimensions, the thickness of their skin. For instance, if they were layer 1 for a certain medication, now they've evolved to like layer 2, putting like 2 layers such that the medication cannot work. So for you to kill them out of the system, you need to take higher layers. Of course, you know, higher level of medication. Of course, you know that there is so much that we can take. Some medications can kill when you overdose a patient. So this is a main problem in the antimicrobial resistance. Yes. So we've seen that there's a projected expenditure that is coming up in 2050. We're expecting that 10 million people will die all over the world due to antimicrobial resistance with the associative cost of $100 trillion worldwide. So this is a very big a problem that is coming in the future. But guess what where the huge problem will be in 2050? The huge problem in 2050 will be in Africa. In Africa, you can see that the highest number of deaths due to antibiotic resistance in 2050 will be in Africa. But unfortunately, we don't know what is happening around Africa, how the medical system is preparing to combat with this problem. So we see here that the recent report has shown that African continents are not actively combating antimicrobial resistance by policies, by health system, by rules. And even when we're doing this research, I got to find out that the application of the special techniques into to antimicrobial resistance were only 5 papers from Elsevier in the whole world, only 5 papers, and none from Africa. And so far, this is the first publication on the application of antimicrobial, application of geospatial techniques to antimicrobial resistance. And the research has also shown that not much is done in the health system in Africa to combat the problem. So the aim of this study is to use geospatial techniques to see how we can look into the problem, isolate the problem, find clusters, and see how we can target them. A lot of times, doctors jump into prescription not knowing where the problem is coming from. I had to argue in the University of Sheffield to my professors that, look, the main treatment is supposed to take place from the location where the patient comes from and not in the hospital, because everyone is sick because of where they live and where they come from, not because of the hospital that they attend. And so since the application of John Snow's study of maps, the application of maps to the study of cholera outbreak in London in 1854, since that time, geospatial techniques have been applied to the solving of health-related problems in diverse ways. A typical example is the recent study we just published on the application of geospatial techniques to the study of maternal access to healthcare, which we divided access into 2 parts. The wet season travel model. We model travel in the wet season. We also model travel in the dry season. And with this, we produced the results. And we had variations in travel in the wet season and the dry season using geospatial techniques. And we also seen that there are 3 other papers there that has introduced the use of geospatial techniques. And the first one there was in Ireland, and the second one there is in Rio de Janeiro, and that's Brazil. And the last one there took place in Colombia. So with all this, we don't have such paper in Nigeria, and this happened to be the first, and then also the first in Africa. So the material method, this study is located in Nigeria, as I've already said, and the result, because of the depth of data was so scarce, and the little we had to, group them into, aggregate them into geopolitical zones. We extracted data from publication, because access to AMR data is not that easy. You need to be in the hospital's environment to get such data. And but we depended on published data, what people have published already, and we extracted that for the study. And we sourced a publication from Google Scholar, PubMed, Embase, Africa Journal Online, and Africa Research Database, AfriDat. And that's the geopolitical zones map there. And then the next result there we see antimicrobial resistance awareness. We found that the awareness was very high in the southwestern parts of Nigeria, followed by the northeast. And there are two possible reasons that can contribute to this. One, the high level of education here. And the southwestern part of Nigeria seems to be a population with one of the highest level of education in Nigeria. And that study was conducted in Lagos. And the pilot location was Lagos. And Lagos, of course, you know, has one of the thickest combination of people in the world, especially in Nigeria, rather. And then with Northeast here again also had a second highest awareness level, possibly because of the hard work that the United Nations and other international organizations are doing to rescue the health crisis that is going on in the northeastern parts of the country. Yeah. And then the results also showed a common organisms that they studied, which was the Staphylococcus aureus and the Salmonella and Heterogeneisa, E. coli, beta-lactamase, and the Klebsiella. So these were just a few. We were able to find like just this in 10 studies. We were able to extract information from, and just 2 to 2, and that's just the percentage. And then we also see the Staphylococcus aureus. We have it here, and the northeast as well, and they had the highest number of studies. We showed that the kind of concentration of this organism resistance in that area. Of course, you know that in research, researchers don't just jump in to study a thing. There has to be a potential warning or sign that would drive them to find out why that is happening. So there's a tendency that could be a problem in that area. And then we have the Salmonella here, the southwest area and the north central as well also had the highest publication and the data that were released to us. Yes. And then we also have E. coli there, E. coli, and then we have the northwest having the highest and the least study of E. coli within the southwest and the north central and the northeastern parts of the country. And therefore, Aeruginosa, we have the north central and the southeast, they're having the highest, and the least was the northeast. So we see a massive variation in the studies, in the way people respond to the problem of antimicrobial resistance. Yes, next one. So we see the various medications that were antibiotics or antimicrobials, rather, that were not antibiotics, antimicrobials there. Antibiotics more of bacteria, but when we talk about antimicrobial, we're talking about all of them put together. And then we have the penicillin, methicillin, prophylaxis, citrazone, and trinidazole, and the rest of them. I don't want to bother you with all those names. But those were the antimicrobials that we found that have been commonly resisted in different states in Nigeria. So we found that awareness was higher in the tertiary facilities compared to lower order facilities such as the health centers, indicating a kind of deprivation in the rural areas, because in the rural areas, that's where we have those lower order facilities where AMR resistance was less. But this was never mentioned in the papers. So it's a kind of by implication that the people in the rural areas are likely to have more of AMR and antimicrobial resistance than those in the urban area. No wonder we have some of the issues of high mortality in the rural area compared to the urban area. We also see socioeconomic disparity there, because in the rich people can afford healthcare in higher order facilities, such as the tertiary facilities, which there is high awareness of antimicrobial resistance. But the poor ones will not be able to access it. They will still use the smaller health facility as the primary health care, which antimicrobial resistance or the rules and the policies are not put in place. So, however, we also found in the studies that this did not the awareness of in the tertiary facility did not in any way translate to the reduction in antimicrobial resistance in those facilities. But in the long run, if you look at the whole picture, you will know that even though it did not translate to the reduction will not be as much as compared to what is in the rural area. And this is what is lacking in the medical publication. So because when medical people who don't really understand geospatial tools, they publish information without breaking them into locations, because in geospatial in GIS, we study clusters. We study to see where are the things actually happening. But these people, because they don't have that technique, they try to produce this result and not knowing the fine details of why, what is happening, and where it is happening. Thank you. So we also see here that it was unclear if the resistance of these organisms varied much by location. As I've told you, we saw no location information to see how locations were compared. As I've said now, we also saw the fuzziness of the studies, the way they reported them. There were no state-level variation, not unaccounted for. And we see other ones. We also see that salmonellosis and resistance in human in Nigeria remains under study and underreported, as is seen in some of the studies. And we could see that organisms could not be mapped in this study. There were some of them we saw, but maybe one appearance. Of course, you can't map one appearance. You need to see like a cluster of more information before they can make sense on the map. And so we see that the prevalence of antimicrobial resistance in Nigeria is deepened by many factors. We have a lack of adequate awareness among stakeholders in the health sector, and they also delay in seeking proper health care. There's a delay. People tend to delay. They want to try out something else before they go to health facility, and by the time they get there, they will be compounding problems in their system. Yes, sir. We see that controlling and reducing antimicrobial resistance will require more participation of geoinformatics professionals and improved data collection and reporting of finding. We all live on Earth. There is nothing we will talk about without talking about the location where we come from. Even if you divide us now, we're certainly going to have some certain diseases that are tied to where we come from. And so if you study health without picking the actual location, the origin of the person, where does the person come from? Beside where he lives. He may live in Calabar, but he had spent half of his life in Lagos or in the northern part of Nigeria. There is something from northern part of Nigeria and something from Lagos that person may have picked that is contributing to the person's health presently in Calabar that the person is living. Location data, being essential for any geospatial study, should be included in available health data. A lot of health data are collected without location information. This makes it very hard to even apply geospatial techniques to healthcare services delivery. And then Nigeria must make Nigeria makes one of the highest contributions to this problem because of our poor health system, lack of policies, lack of government commitment to our system makes it hard. Even since 2015 that the United Nations set up the SDGs and worked on reversing antimicrobial resistance, Nigeria has not come up with a sincere and a drastic policy to reverse this problem. So we also see that though with limited data, we have set the pace for further studies, for planning, and at any level, which anybody, we're calling for more people to come, let's fight this fight together. Yes. In conclusion, a war is coming, or a war is ongoing. It's not a war between Russia and Ukraine. It's not a war between US and the Taliban. It's not a war between Nigeria and the unknown gunmen. This is a war between human beings and the unseen things that are coming. It is the war between human beings and microorganisms who are everywhere, fighting our existence. If we do nothing by 2015, we all will be wiped out. Because once the drugs no longer work and nothing is happening, we go to the hospital and then we find no solution to our illnesses. There's a tendency that the human race will be wiped out. That's why I'm here today to raise the awareness of antimicrobial resistance and how just special professionals can come in to join together. If Special techniques have been used to fight physical wars. And there have been successes. You see the use of drones in Russia, fight with Ukraine, the successes. And we can also apply all this to fight for our very existence as human beings, because if we don't do it, the microorganisms will take over the world. Thank you very much.
Thank you, Dr. Otu. We gave you so much time because we were enjoying your presentation. Okay, we thank three of you who have made presentations, and it is time now for us to interrogate the presentations, the papers. Questions, comments, we'll take them now. Yes, please. Somebody should help us with the mic there. Chairman, let us have the mic.
I have maybe like 6 questions, but I'll ask one first and leave the floor to other people so nobody comes from my head. I will start with the last presenter. Papers that have been published in the field on antimicrobial resistance, and you were talking about the prevalence of some particular microbes like Salmonella and E. coli, and you said there are no location data on that. Did you check with WHO? Because I can confirm that one of the work that they do with the State Ministry of Health and the Federal Ministry of Health is to collect data on prevalent diseases, parasites, and microbes per location. So any state coordinator of WHO would have been able to provide you with some data sets that would have enriched this study. And then you also said the percentage that Nigeria contributes the highest burden for antimicrobial resistance. But you did not give us the percentage or the proportion that Nigeria contributes in comparison to what the global figure is, right? And then it would have also been nice to, okay, let me not probe too much so it doesn't look as if I'm tearing down your presentation. I am not. This is a very fantastic work, and it's a good beginning for additional studies. So maybe it might be nice to go back and look at those data sets so you can map by location the prevalence of these diseases. If I still have the floor later when other people have spoken, I would ask the other parts for the election and the volunteer geographic information.
Thank you. Questionnaire. Down. We want to take more questions now. Yes, sir.
Good morning.
Sorry, sir. Let me just announce. Sorry, sir. If any of us have papers to present, please proceed to the technical area and upload such so that after the question and answer, we proceed. Thank you. Sir, continue.
Morning, my president. And please, all protocol duly observed, please. My question is to the first presenter who spoke about election. I just want to know whether he got some data set from INEC and Population Commission to enrich his analysis before coming to that conclusion. Because population is involved. And to do that, to do justice to the study area, you must have their phone numbers. Let me stop at this level because of other people.
Thank you, sir. Okay, my co-technical man here wants to ask a question too.
Thank you very much. First, I'd like to appreciate all the authors for doing a fantastic job, and I'll take all my questions for all the authors. So for the first presentation, Mr. Bamidele and Benedict, I have 3 questions for you. You spoke about e-voting, and I think if you are to use e-voting in a country, you would need your internet facilities to function well. My question is, did you consider the rollout of internet all over Nigeria for it to be effective? So timelines, what are the timelines which you anticipate Nigeria to fully implement e-voting? Secondly, cybersecurity. As much as we are moving to an IT-driven sector and we are moving to databases, whether it's electioneering or population or census, are we, or rather, did your study consider cybersecurity in terms of protecting the information that will be collected? Because wherever you collect information online, there must be hackers. There will be hackers looking to tamper with that information and tamper with the results to ensure that you give out false information. My third question is on the system you proposed. Is it location-based? If it is, can we incorporate voters from the diaspora to take part in Nigerian elections? Can they be engaged in the e-voting process? So those are my three questions for Bamide and Benedict. For Mr. Edward, who is representing Mr. Laka, you mentioned Delimi River. I wanted to ask, is it in Plateau State, is it the same Delimi River that goes through Bauchi State too? If it is there an integrated river basin management plan in place where both governments or both states collaborate? Because if they collaborate, then you can reduce certain flooding issues. Because that's the whole aim of having an integrated river basin management, for collaboration between states or within countries. So did you consider if there is a plan available? And if there's not, one of the takeaways from that can be, we can make a proposal to say that there should be an integrated river basin plan. Then my last question is to Dr. Edet on the antimicrobial. You're one of the first